Breast augmentation, very popular procedures, probably one of the top 5 procedures that I do in my practice. It involves making an incision, usually in the crease of the breast, and I'll place an implant underneath the pectoralis muscle to create volume and increase shape and size of a woman's breast. So there's 2 main types of a breast implant. There's a silicone gel implant and there's a saline implant. A saline implant comes empty, it's a silicone shell, and at the time of the surgery, I will fill it with sterile saline. Silicone implants are pre-filled, so they come kind of already filled with the gel based on the volume or the weight or the size of the implant. One of the pros for a saline implant is that it's inexpensive. So it's probably about $1,000 cheaper than a silicone gel implant. The other benefit of it is that you can insert it through a very small incision because it comes empty and you roll it up like a taco and slide it into the pocket, and then you can fill the implant. The other benefit of a saline implant is that it is radiolucent, meaning on a mammogram, the radiologist can see through the saline because it's water. The downside of a saline implant is that it tends to feel more like a bag of water, and it behaves kind of like a bag of water. So when you stand up, all of the water is going to fall to the bottom of that implant. And so saline implants are more likely to shift or bottom out or stretch the tissue because of its weight. It's also more likely to ripple or have waviness on the edges of the implant that you can sometimes see or feel, especially if you're a thin patient. The pros and the cons of a silicone gel implant are the exact opposite. A silicone gel implant feels more natural, it looks more natural over time, and it stretches less on the tissue over time. It's more expensive. It sometimes may require a little bit of a larger incision, and it is radio opaque, meaning on mammogram, it is going to look like a kind of a ball of gel. The beauty of a silicone gel implant is that there are a variety of different options based on individual patients' body types and their desired postoperative results. So here I have an example of 3 different profiles or projections of implants. There's actually a total of 5 that are available. There are 2 that are lower and flatter, but I typically work with these 3 types of profiles or projections. And so this first one is a moderate profile, moderate projecting implant. This is a full profile, full projecting implant. This is an extra full profile, extra full projecting implant. And you can see that each one gets a little bit more projecting or sticks out further from the skin. And the narrower the base width or the width of the implant gets. So for patients, I want to select the appropriate implant that's going to fit their frame, but also give them the desired postoperative result. After implant selection, we'll talk about where I should place the incision to be able to insert the implant. And there's a couple of different options for patients. The option to put it in the crease or the fold of the breast. There's also an option to put it at the base of the areola. And then there's sometimes, but rarely for me, an option to put it through the underarm. The most common incision type that I use is in the base or the crease of the breast. Part of that is because using an inframammary crease incision helps to decrease the risk of capsular contracture. It also helps the surgeon have the best control and visualization of the pocket. And with the inframammary crease incision, there's less incidence of implant malposition. Then I talk about the placement of the implant. Am I going to place that implant above or below the muscle? I will usually put an implant below the muscle in probably about 95% of the time for patients. Having that extra layer of the muscle on top of the implant helps to soften the edge of the upper pole, so it makes it more natural appearing, less visible. After breast augmentation surgery, patients will be put into a postoperative bra. It takes 6 weeks for incisions to reach 90% of their ultimate strength, so I don't want there to be any undue compression or added stress at the incision site. So they'll wear a non-underwire bra. Afterwards, I will seal the incision with a layer of skin glue so they can take a shower within 48 hours after the procedure. But most patients can go back to normal activity after a day or 2. The only thing that I ask them to avoid is exercises that directly contract that pectoralis muscle, so chest exercises. I ask them to wait on those exercises for 3 months.